All right, so here's the question. What's wrong with Princess Kate? Let's bring in royal expert and commentator Victoria Arbiter. Good to see you. Happy New Year. Sometimes I have fun about interest in the royals, but not this. This is health related. What do we know, and what are the open concerns?
Good evening, Chris, and always good to see you too. Well, Buckingham Palace is typically quite tight-lipped when it comes to medical issues related to members of the royal family, and rightly so. They're entitled to the same level of personal privacy as anybody else. But we do know that she underwent abdominal surgery on Tuesday, and beyond that, we haven't been told too much else other than she's going to be in hospital for up to 2 weeks and off royal duties until, give or take, around Easter, which is at the end of March. She only turned 42 last week. She is fit, she is healthy, she's incredibly athletic. So while they have said that the surgery was successful, it does indicate that it was very serious, given hospitals like to get patients in and out pretty quickly these days.
Right, and you know, I've been looking at it. So the most common things would be umbilical hernia that comes, or abdominal hernia that comes from sometimes childbirth, not this long a recovery. Endometriosis, which can have a long recovery, but usually not this long a hospital stay. Colitis, but she's young for that. And it would have been something that, especially given her proclivity to do public service, she probably would have announced, because she'd want to raise awareness about it, especially in a young mom. So is there concern that this is too long for something that would have been, you know, not worthy of mention?
It's certainly possible, and it's entirely likely that she will discuss this as and when she feels ready. At the moment, she just felt that she needed to let people know that she's in hospital, because any kind of prolonged absence is going to be noticed as a public figure. She does carry out multiple engagements on a weekly basis. But I think also we have to look at the fact that royals typically try to get in and out of hospital very quickly because they're aware of the disruption their presence causes. There's now a police officer at every door to this hospital. There's huge press interest. There's huge public interest as well. So I suspect having the whole world talking about your medical history is not terribly pleasant either. But it is good that they've at least tried to take control of the story and regain control of the narrative, because they know that people are going to be concerned about her long-term health.
Although it is curious that with King Charles, or whatever, I'm supposed to call him King Charles? It's King Charles now, right?
Yes.
All right, so King Charles, he went in for an enlarged prostate. That's, you know, that's pretty indelicate, right? You know, they put that out there. So why be quiet about this if everything was okay and you talk about the king's prostate? I mean, you know, that's not exactly delicate.
It's not, Chris, but I think we've got two factors here. Number one is his age. He turned 75 in November, and so soon, relatively soon still, since the Queen passed away, I think they wanted to make sure that they reassured the public that it was nothing serious when he enters hospital next week to have the corrective surgery there. But also, and I think this is far more interesting, since the King revealed his diagnosis, the NHS has said that the page about benign enlarged prostate on their internet page has jumped by 1,000%. And this is what the King wanted to achieve. So many men suffer from enlarged prostate over a certain age, but they're too reluctant to go and seek treatment and even see a doctor. So the fact that he has shared this news means a lot of men are going to seek help, and that's only a good thing.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.